see. Hi, welcome, Emily. I should introduce you. So I have Emily Graham here today. Emily is second starting third year medical school student at the University of Utah, and I'm going to interview her today and learn more about what life is like as almost a third year and kind of talk about her decision to go to med school. So thank you, Emily. It's fun to have you here.
Oh, it's so good. Again, thanks for having me.
I know. It's so fun to do this because I get to see like friends. So, okay, so a little bit of background. So I met Emily because she came into the office and she said, I'm finishing up my nursing degree and I want to go to med school. I'm like, whoa, that's cool. So Emily, tell me, what was that decision like for you? You know?
Yeah, so I mean, my decision to go to medical school really stems like back to as long as I can remember. I've always loved medicine as long as I can remember. Like when I was a little girl, I was the one sitting on the sidelines with a first aid kit, waiting for my friends to fall off their bikes so I could fix them up. So then they could start play again, you know? And so I think it's my love of the human body, my love of medicine that drove me to pursue nursing as a career. Just because when I started BYU, I was looking at all of these different majors, and I really liked the health sciences. I liked biology. I loved chemistry. And there were a couple of others like, I think there's like human biology and physiology. I loved all of that stuff, but I was like, I want to be in the hospital. Like this is where I belong. And so I chose nursing as a career and as a major. And then I ended up serving a mission, and that was great. Like after my first or second semester of nursing school. And then when I came back, I was in the clinical realm within my degree. So I was in the hospital doing long shifts, and I liked it, but something felt like it was missing. And by my third or fourth semester of nursing school, I was like, okay, I don't feel quite right about dropping out of nursing school, even though something doesn't feel right. But I mean, I would pore over my textbooks and I wasn't ever satisfied with the answers. Or when I'd ask questions in class, like for example, we'd learn about a disease like hyperthyroidism. And I'd say, well, why is it that the thyroid is doing that? And why do we treat Graves' disease the way that we do? And why is it that we do certain medications over the others? And the answer was always, well, that's beyond your scope of care. You don't need to worry about that as a nurse. You just need to, understand the drugs, and you need to understand like the basic physiology and pathophysiology behind things, but you don't need to go into the in-depth explanations for why. And at that point, I was like, okay, I know I need more, but what career do I choose? Because at that point, the easiest route would have been for me to go into nurse practitioning school. Another field I was thinking about was to become a PA or a physician's assistant. And then even within the physician realm, there's the MDs and then there's the DOs. And it took probably somewhere between 6 and 8 months of praying and fasting. And I interviewed and I shadowed like a madwoman. So in all my free time, I was calling all of the PAs I knew and I shadowed as often as I could. And then I did the same thing for nurse practitioners and MDs. And I just tried to figure out what was a good fit. And from what I was able to tell, nurse practitioners and PAs, they are able to prescribe and they are able to do a lot of interventional medicine, but it's not like they're the end all people who know everything about their specialty. And I think for my personality, I wanted to be the person where if a patient came to me, I would be the one with the answers, or I would be the one who knew how to find the answers, versus a PA or an NP are kind of limited in what they know and can do because they can't specialize like a physician can. And since I later figured out that I wanted to do surgery, and that option really only is possible when you become a physician. So it ended up being a good decision, but I mean, it took a long time of praying and fasting and doing a lot of work with my husband. And ultimately, we said one more prayer and it was, okay, I think the answer is medical school for me. And that ended up being a perfect fit for my personality and what my career goals are.
That's so cool. Do you regret doing nursing? I mean, I guess like from my perspective, I kind of look at like when you get on a path, it's very hard to kind of get off it and do something different. Was that difficult? Or, I mean, I guess you could say like, do you wish you would have done all of that work before you started nursing school? Or what do you think?
There are times when I felt bad about my decision to become a nurse first. because it was a longer path. It takes longer to get your nursing degree and then to do all the pre-med requirements and apply to medical school versus just doing a biology major or chemistry major and then applying into medical school. But you know what? I feel like, especially since this is a BYU interview, I feel like that's not the purpose of the atonement, right? Like the purpose of the atonement isn't that you'll never take a wrong step, but it's that whatever step you take will be made the right steps. So turn to the Savior, right? So for me, was nursing school like the right thing? I don't really know, but I do know that it's going to be used for my benefit as a future physician. And there are things that I really value with my nursing degree. I think it makes me a better team player. The clinical exposure that I had prior to medical school is invaluable. I think that was something that all of my medical school interviews talked about. They loved the clinical experience that I had because medical schools, when they're looking at applicants, they're trying to put a flavor to a student. They're like, okay, well, what flavor is this student? Is this student a researcher? Is this student a humanitarian? Is this student a clinician? Is this, they're trying to label you because they want a diverse class. And so when I applied, I was that heavy clinic, multi-experienced nurse who had so much to offer to the table, whereas a lot of my cohorts came from a very sciencey background with lots of research. So yes, there are deficits. I've had to learn a lot about research and I've had to learn a lot about academia since starting medical school. But I think overall in the end, it will be a good decision in the long run.
So I guess just kind of following up on that. So what did so many medical schools really do require that you have some research experience. Like as a nurse, how did you kind of say, I have enough research experience to satisfy what you need, or what did you do with that?
So there are going to be some, and I didn't realize this either, but depending on the program you're applying to, they're all looking for different things. So if you want to go to an Ivy League program, then you need to publish and you need to do research. I don't know very many students who have zero research like what I had when I applied to medical school and got into an Ivy League. There are still top 40 programs like the U that loved me just because I made up for that in other experiences. So because I had so many clinical hours and because I had so many other experiences with patients, I think in their mind that outweighed the need for research. And I learned how to do research. And since then, I've had a number of publications and it's been great. The U has, just phenomenal mentors here and they've been able to help me where I've been deficient. But I think when you're applying to medical school, if you are able to figure out what is your dream school and why, you can best tailor your application to fit what they want.
So, so you came to the decision, I guess, at a different juncture in life than a lot of the applicants that come into the PPAC office. What do you wish you would have known as you kind of started that application cycle and went through it?
The pre-med world at any school, and I'm sure it's the same for BYU, but it's very competitive, right? Like these are the kids who are very smart. Most of them are type A. And if they look like they're a type B person, chances are they're just faking it and they're all type A's, right? Like you can't go through all those hoops and get those high grades without being very organized, structured, and driven. So I wished I would have known how competitive it was, but also to be okay with it because I'm up for the challenge. Like I can be that person and I can be competitive and I can succeed just like everyone else around me. I think when I first started, I was a little bit intimidated because I had to jump back into a bunch of basic science courses that I had been out of the loop of for a couple of years. But rather than choosing to become discouraged, I just chose to see it as an opportunity and I chose to replace words like anxiety with excitement. And I chose to get myself excited for the pre-work. One thing that I recommend in general for people who are starting down the path of medicine is to start early and to set up a network early. So one thing that I think was helpful was when I finally made a decision to become a doctor, I went to the pre-health advisement office and I met you and it was really great.
So helpful right there.
Applying to medical school takes a lot of work. Like there's so many interesting little facets that you have to know. And it's impossible to do all of that information on your own. Like you could, but it would just be easier if you had a counselor or someone who knew the process better to help guide you and, give advice. And so I think that was really helpful. Um, Another thing that is really helpful is to start research and volunteering early. So for me, I didn't have to do a lot of research, or I didn't have to do a lot of volunteering or clinic experience just because I had that with my nursing degree. But I did start research the moment that I knew I was going to medical school, and I got a couple of poster presentations thanks to that. But medical schools want to see a long, like a history of commitment. One organization for at least a year, right? So I know a lot of people who would volunteer at 15 random organizations once for a year versus I had these service organizations that I had volunteered at for years. And I think that speaks volumes because it shows commitment and passion and a little bit of grit too, because I kept those commitments despite taking full heavy science loads and working at the hospital. Same thing with research. Research just takes time. And I think another thing that's important when you're starting research at BYU is when you find a professor with whom you want to do research, you need to establish goals. And so when you sit down with a professor and you say, listen, my goal is to go to medical school. And because that is my goal, I need paper publications. What projects can I jump on that will get my name on a paper manuscript publication? And obviously, you talk about interest, pick a field that you're interested in. It doesn't really matter what the research is in, but they want to see paper publications and poster presentations, and your name needs to be out there. So I recommend starting early. And finally, let's see, I'm just looking. Oh yeah. When talking with science professors, when you apply to medical school, you need like 5 or 6 letters of recommendation. So rather than just focusing on just getting A's in your science classes, also try to build a relationship with that faculty member, because let's say you take organic chemistry from one person for the entire year. If you do that, you have not just a good grade in that class, but that professor can say, yes, I knew this student for a year. I know how they perform. And I also know them as a person. And yes, this person, I can vouch and say that this person will be successful in medical school. So start research and volunteering early. Get to know your professors and build a relationship with them. Even if you don't have questions about the class, use office hours just to talk to them and talk about the field that they're interested in. I think that building that rapport is very helpful for when you're looking for letter writers. And I also think writing thank you notes at the end of every semester is just a good, it's great manners to have to write thank you notes, but I also think it's good to build that rapport. That way they recognize your name when you come back a year later asking for a letter. And my final bit of advice is, if you feel like quitting, don't. It's a long process. There's hard days, but it's so worth it in the end. I love medical school. It's so much better than the pre-med life. And
I love hearing that. And I guess for anybody listening or watching this, I'll say Emily truly loves it. As we've stayed in contact just a little bit, it's been so fun to see how much this has been the right decision for you. Legitimately, it's just exciting to see you kind of fit into where you want to be. So I love seeing that. But can I ask a few more kind of letter questions to you, just because that's something that I feel like as I've done some of these interviews, I haven't brought up enough with some of them. It's just, and that's something that BYU students in particular need to kind of know about right from the get-go, especially, those science letters of recommendation. And not all medical schools require a science letter of recommendation, but a lot do. And so it just kind of breaks my heart when they get the letter of this person was in my class, they performed in the top 5%. I think that they could do well in medical school because they're smart. And end letter, right? And you're like, oh, if that's what the medical schools want for a letter, okay, but I know it's not, so you said go to office hours and, write thank you notes. Do you have any other kind of words of advice? Just because I think it's often pretty intimidating. Classes are pretty big. The professor is the end all be all. So how do you do that? How do you overcome that intimidation factor to get a letter? What do you think?
Like I said, when I started the pre-med world, I just felt kind of inadequate. Maybe I wasn't quite enough. And that feeling never really went away. And I admit I still have it even now in medical school, right? Like there's so many incredible people around you. And because the atmosphere just tends to be a little more competitive and intense, it's easy to get imposter syndrome or to feel like um, you're not quite where you're supposed to be, or maybe you're not smart enough. But just go for it anyway. Like you have nothing to lose. I I would just advise students to learn to be comfortable being uncomfortable. Like that's just what
Mhm.
medicine is. You're constantly going to be pushed outside of your comfort zone. And so even though it's uncomfortable to, say a couple of sentences to the professor after a lecture, or to, a couple of questions to follow up, even though it's a little bit nerve wracking, just go for it. Just do it. Even if you're nervous, like it gets easier with time. And I just, my mom always just said, fake it till you make it. And so I just pretended to be the most confident person that I could be. I just pretended that I was, the smartest person in the room. And I just pretended that I was the most competent student in the room. And so when I talked to the professor, I think maybe some of it did come across as like, that maybe I was like really smart and competent just because I was faking it. And even though my heart was racing and it was nerve wracking a little bit, I did it. So building that relation, and some professors are much more personable than others, and so that makes it easy too. I think a lot of the people at BYU are supportive and helpful, and I really appreciate my training at BYU, so I don't regret that at all. And then when I was finally getting to the position where I needed to ask for a letter of recommendation, I used specific terminology. I said, hello, doctor. So for example, I think I asked Dr. Price within the OChem department. I said, Dr. Price, I took OChem from you. I, got an A, and I feel like we have a good relationship. Would you be comfortable writing a strong letter of recommendation? And for me, I define that as, not only, put my rank and like what grade I got for both divisions of OChem, but also if you could maybe describe a story of how I interacted in class and also how I interacted with you, that would be very helpful. And I think that's what made my letter strong. And I got letters from science professors, some of the managers I had at the volunteer institutions, a work manager, and a couple of other, and also a PhD. And all of them I asked, will you please write me a strong letter? And if you can use any stories that illustrate my professionalism and my maturity, I would greatly appreciate that.
And I'm happy to remind you of stories where I illustrated my professionalism to you. That's what I want to say. I'm like, if you can't remember, I'll help you because I promise.
And you know what? Another thing I did if they weren't sure, because oftentimes I would ask them in person. I wouldn't email them. I'd ask them in person, but then I would immediately that same day follow up with an email and say, okay, Dr. Price, I would really appreciate a letter within the next 2 weeks. Here's a basic format of examples I've seen online of what you can do. Just like that way they can look at it and be like, oh, okay, write obviously in the first like paragraph her stats, and then afterwards write a good story with like a testimonial of this person, and then sign it.
So
So
I like when students ask me for a letter, I say like, okay, so tell me why you're asking me to write the letter, and that does not, they don't need to compliment me. What they need to do is say like, I had this experience with you and this is what happened from it. I had this, I contributed in your class and this is what I said and this is what you said when that happened. Just because I just think everybody's the star of their own show. It's amazing how you kind of forget, like, I know that Emily's awesome. Oh, that's right. She's really awesome because of that. Anyway, I sometimes think we're kind of afraid to help them with it. And of course, it's always the letter writer's
mm-hmm.
call, but I love it. I tell the students to say like, what can I provide to you so that you could write me a strong letter of recommendation?
Yes, I think that's great. And some of them did say that, and so I would attach my resume or my CV to the email as well, that kind of look and see who it is I was. But yeah, I think that's all very helpful. So yeah, you won't ever not be scared. I think it's an intimidating process the whole way through, but it's okay. Like it's okay to be uncomfortable, and you just need to go for it, and it's all going to work out. So,
and even this person who was really successful doing it was uncomfortable getting it done. Like, I love that. So thank you. You're like, it's hard. You're asking them to do something for you that, it's kind of a pain.
Yeah, so. And writing is hard too, because I think we're taught to be humble and to be, patient and long suffering. Just like
Like,
kind of background that a lot of us have. And so asking for people to write us a strong letter and be like boastful about who we are as a person is hard. At least
mhm,
it's hard for me.
mhm.
Um, but you just need to realize you need to put your best foot forward. So listen to some rap music of people boasting and like just go for it. Just try.
Just build yourself up right there. So, okay. So I guess another question I had for you, just a little bit, is just um, I know that there are sometimes some female applicants that I've worked with that haven't felt as supported in their quest to become an MD, and we're working on doing our best to help support that as much as possible. But do you have any particular advice for that subset? Or, besides like fake it till you make it and go for it. But is there anything else you could add to that? I don't know.
Yeah. Um, no, the feelings of loneliness are very real. And I definitely remember those feelings poignantly when I was a pre-med. Something that helped me a lot, especially when I had a really long day or it just seemed like I was working and working and working and not feeling like either fulfilled or satisfied or supported, is one I remembered why I wanted to be a doctor. And that reason for me is that I want to heal as many people as I possibly can because I feel like God has given me very specific talents. And I feel like this is something that I need to do with my life. And so I'm willing to sacrifice and I'm willing to suffer through hard days because I know in the end, this is what's going to make my life meaningful to me. And I think it'll also help make me feel confident when I return to heaven at judgment. Like I think that's one of my goals. It's to help as many people as I can. And so even though it's really hard and sometimes you can feel alone, you don't need anyone else to believe in you other than yourself. Like if you can believe in you more than anyone else, you'll get through it. I know that's hard because especially as women, there's numerous studies that show that having a very strong support system at home and at work is important for success. You need to believe in yourself above all else. And also, if you feel like having a physician, like being an MD is something that you want to do with your life, or maybe that you're called to do with your life, then also know that Heavenly Father has your back. Like, and you are more than entitled to have the Holy Ghost with you to comfort you and to help guide you and to help you problem solve and to help you conquer whatever challenge you face in that pre-med realm.
Oh, I love that. Thank you. Okay, so Emily, you just finished up your boards, and I won't have you say this, but I know that you did really well. And I'm like, so congratulations. But I guess what's your plan? Like, what do you hope to specialize in, and why is that interesting to you? And kind of, did you know that before you started medical school? Like you said, you wanted to do surgery, but tell me how
Oh,
you kind of learned what you want to do.
so it came as a complete shock when I was a nurse and I made the decision to go to medical school. I was convinced that I was going to be this very cerebral internal medicine doctor. And I did not do surgery at all because they were the grumpiest doctors to me as a nurse. And so I was like, I will never do surgery. But then when I made the decision to become a doctor and when I was still finishing up nursing school and then when I was working full time as a nurse, I was shadowing more. And then I also had the wonderful opportunity of working in the surgical shock unit at the University of Utah as a nurse. And at the surgical shock unit, we work with almost every single surgical specialty. And we did all transplants with the exception of heart and lungs. But we did kidney transplants, lung transplants. And then anytime someone was really sick and needed a multidisciplinary care team with a lot of surgeons, they came to our unit. So it was a very interesting experience because all of a sudden I was interacting with a lot of different surgeons. And there were a couple of cases. So actually, before I go into this story, what I want to do now is I want to be a reconstructive plastic surgeon. So a lot of times when people think plastic surgery, they think of like a cosmetic or an aesthetic surgeon. That's definitely a major part of the field, but I'm hoping to, I think, subspecialize into hand and microsurgery. And I came to that conclusion after this experience. And when I was working as a nurse in the ICU, about a third or a fourth of our patients actually had self-inflicted gunshot wounds to the face. So they're called failed suicide attempts. And I remember as a nurse, we would work really hard to keep them alive. And so And that was considered success on our floor, right? Like their heart was beating, their blood pressure was stable, their vitals were stable, and then they could be discharged. But I just remember looking at these people, and oftentimes they would have their sight gone, because their face is, mostly gone. It's pretty graphic. And I just remember thinking, what kind of life are these people going to have? And, and every single patient I talked to expressed extreme remorse about the decision that they had made to try and commit suicide. And all of them wished that they had just never done it and they wanted to restart, but they couldn't because they had a permanent physical reminder of their actions. And it wasn't until the plastic surgery team came around and they would reconstruct these patients' faces. And all of a sudden, like, it wasn't 100% back to normal, but it was a working face. Wasn't something that their family members, friends would gasp at. And so for me, plastic surgery was, and reconstructive surgery in general, was the most redemptive and beautiful form of medicine that I could find. And every time I looked and explored other specialties, I just always circled back to plastic surgery. I think it's wonderful how you can enrich people's lives by restoring their form and function, like being able to give people their independence back and, helping people feel like they are themselves. It's a wonderful experience. So for me, I think medicine is much more than keeping someone's heartbeat going. For me, medicine is about helping people reach their full potential with happiness. And I think plastic surgery is a way to provide people second chances and to live life to the fullest. So that's what I want to do now. And that's kind of how I came to that conclusion. And I think now I'm leaning more towards hand surgery just because as I've done research and within the field, and one of my main mentors is a hand surgeon who, did a plastic surgery residency and then you get a fellowship afterwards. He's a hand surgeon. And so I think that's had a huge influence on my career trajectory.
Interesting. So I guess help me understand, I guess I always think of cosmetic surgery as being like for the beauty is in the eye of the beholder, right? Like very kind of, so like when you say like hand plastic surgery, I guess I'm just trying to because we want to make the hand look better, or I guess burns,
Yeah, there's burns. If you think about it, a lot of people end up losing their fingers or they'll have their hand completely, chopped off in an accident, and it's a hand surgeon that reattaches everything as well. So there's a lot of different procedures that hand surgeons do. There's also a lot of congenital differences that children are born with, and surgeons can go and make a hand actually look like a hand and then also be able to have normal function. So it's a really cool field.
That's awesome.
You think about, so the very bottom, there's things like carpal tunnel and there's things like trigger finger, and at the very top ladder of reconstructive surgery is to actually transplant. So plastic surgeons actually face and hand transplants too, which are really cool and inspiring.
Oh, that's awesome. So
yeah, it's very interesting.
All right. So thank you. Any other words of advice? I can't think of anything. I think.
Yes, I have.
Yay! Let's hear it. Let's hear it.
So for those doing the application cycle, and I only know this because once I was a medical student, I actually helped give tours to people who were interviewing at you. Please dress business professional, not business casual, business professional.
Like a suit.
A suit, yes. And women don't wear super high heels and don't wear so much makeup that it's distracting. I know that's kind of hard and it's an extra thing that women have to deal with, but dress business professional. And if you don't know what that means, talk to Christina. She'll help you.
This was pre-COVID. I'm in a lot of joggers now, right? Working from home.
That's true. So if it's an in-person interview, business formal, like business formal. So another thing, get your application in early because a lot of schools have rolling admissions, and I think that can have a huge impact. My application went in day one. So I think it opened May 1st when I applied.
June 1st.
And I submitted, or June 1st. That's what it was. So it opened June 1st, and I had my whole thing done and ready, and I submitted, I think, that late morning of June 1st,
And also, you applied to how many medical schools?
I only applied to 15 or so, but of those 15, I got 3 interviews and 3 acceptances. And then every institution I interviewed at offered a scholarship. So
that's so awesome.
Really good.
Yeah. No, I just think on average we have those who were accepted this last year applied to 39 schools,
Yeah.
and I mean, that's a bit of a misnomer in the sense that we don't know how many secondaries were actually completed of those 39, but I think it's just helpful for students to kind of realize, like, you're going to apply to a lot of schools, right? Like, you're a really good applicant. You applied to 15 schools and 3 interviews. You're like, you should have had 15 interviews, right? But like, it's just kind of not how it works. So applying more
So
is just kind of how you have to do it. So
yes. And I know people who apply to 50 schools. Like that's I think a common thing. So apply to as many schools as you can. I think that's actually a regret that I have along the process because I didn't apply to very many.
Mhm.
Another just some other tips for the interview process, just
Yeah.
because it's fresh in my mind. When you okay, let's see. Oh, pack Listerine strips because whether it's MMI formats or you're doing one-on-one interviews, you can pop a Listerine strip in your mouth, but chewing gum during an interview is very tacky, so don't do it. It's very distracting to be talking to someone while they're like on gum. So just use a Listerine strip if you're nervous about, halitosis. Another thing that I did was for lunch is often provided and it's great food, but lunch is also a time where you sit down with other medical students or PhDs or faculty and they'll want to talk with you. So because I get hangry, right before lunch, I would run to the bathroom and I just like vacuumed in a Cliff Bar. That way I wasn't so hungry. That way I wasn't like so focused on eating that I wasn't talking with people. So I focused more on talking and conversing with people and I wasn't hungry for my interview
Oh, that's
or for the
awesome.
lunch part. Some other advice I have, like, do you want advice for like when they start med school?
Oh, well, let's talk about interviews for a second, just because I'm
Okay.
like, a lot of the interviews are going to be virtual this year with COVID. So, do you have any thoughts on that about, I mean, it's different for everybody, so we're all just kind of like scrambling around trying to figure out what to do. But, um, so halitosis isn't a big deal for
That's true.
for the virtual interview, but like, what do you think? Is there anything that just kind of pops out that you're like, just be smart about a few things?
So I think that when I applied to the University of Utah, we actually had to send in an online video. So they had a couple of questions, and so I had to record myself talking into the camera and answering questions. So I think I can maybe sort of relate.
Yeah.
One, make sure your background is professional. Like, don't just choose like your headboard or something else. Like, try and make it look like you're in a library or that you've got like some nice bookshelves or something pretty behind you. Make sure that you are completely in business formal clothes again, because you never know. What if they do ask you to stand up? You don't want to be wearing pajama bottoms on the bottom just in case. So just and then also make sure your internet connection is great and that no one's going to disturb you. I'd say
Yeah.
that these are big ones, but I'm not quite sure.
I
Just
know, it's going to be something this year to kind of
yeah,
see.
I guess like make sure you're looking at the camera as much as you can. Make sure you're like sitting up straight, just like general tidbits. Another
I would probably say, like, don't go for a virtual background,
yes,
just
yeah,
because like, there's no reason to do a virtual background. Like, be prepared, you know, have something professional behind you, and that doesn't mean a virtual background, because then sometimes I think virtual backgrounds are just a little bit more distracting than
I
anything.
agree.
So
I agree. And then plus they're always wondering what's really behind you. Um, and then just like I guess other interview advice, you don't have to respond right away. Like if they ask you a question, I think it actually looks better if you take a second, take a breath, think about a nice logical response, and then give that. And then when you're done with your response, stop talking. Because if they're going to look at you, some of them did this, it's like part of their training. They'll look at you and they'll like raise the eyebrow or something. But if you're done talking, if you gave a good answer, you can just stare back at them. It's okay. You don't have to like keep rambling or trying to justify your answer. Give a good explanation and then be done. Be confident.
I like that. Um, so I guess you mentioned, so I do want to know, like, what are you glad you did to help you prepare to start medical school? Was there anything that you're like, ooh, that was so helpful? You
Oh,
had tons of clinical experience, which is great. But is there anything else that you're like, I've just found that to be valuable. I don't know.
Yeah, setting up a network fast and building
Yeah.
network like mentors fast right from the get-go of med school. So the summer before I started medical school, I was working full time, but I also chose that was when I was going to start research for real, and I was really going to learn. And so I met a bunch of PhDs, I met a bunch of surgeons, and I worked my tail off and I got to know them. And I think that's made a huge difference so far, because now as I'm starting third year and I'm about to enter the hospital realm, a lot of the surgeons at the U already know me. And if they don't know me personally, they know my name because I've just kind of integrated myself into their space, you know? So I think building networks, and again, that support system, right? Like medical school is hard. It's just as hard. Well, let me say it this way. Medical school is just as hard as you anticipate it to be, but it's not nearly as bad. I think it's much more fun and much more rewarding, and it's just better. But I think having those mentors who can advise you and help prepare you for the next steps along your career path is huge. So I'm really grateful that when med school started, I'd already kind of built up a little network for myself.
Mm-hmm. Other things, anything else that we should? I'm trying to think. Did I miss any questions?
One thing I will say, just in general, and you can start this even as a pre-med, decide today what type of doctor you want to be. So just like medical schools are going to pick you because you're a certain flavor, right? Whether that's because you're an artistic individual who, you know, is great in the humanities, or you're very analytical and you're science driven, like you're going to have a new flavor when you start medical school, right? And that doesn't mean specialty specific, but you're going to have a brand. So decide now that you're going to be the type of student who doesn't complain about the hours, who is positive, who chooses to look at criticism as an opportunity to grow rather than as a personal attack, and try to be the doctor who is all in. You know, I think it's for me, I think med school could have been very easy because, you know, a lot of this I covered in nursing school, at least the first year. I think a lot of it covered in nursing school, and it would have been very easy for me to coast. But you don't want to be the type of doctor who coasts. You know, you want to be the doctor who really understands this stuff, because in the end, it's going to affect people's lives. So decide to be all in. Another thing that was really hard for me when I first started medical school, and part of this is because I work with surgeons, is oftentimes the only feedback I would get was like constructive criticism or negative feedback. So they would only tell me the stuff that I sucked at and not the stuff that I was good at, right? Because in surgery, or at least with a lot of the surgeons I know, if you're doing something right, then they won't say anything because you are proficient, and that's kind of expected. But if you're doing something incorrect or wrong, they'll definitely let you know. And so for me at first, it was really hard because coming from a nursing background, and even BYU, where I feel like the professors are, you know, much more apt at giving positive reinforcement and telling you that you're doing a good job. They don't necessarily, not all specialties and not all doctors will do that all the time. And so don't choose to not be discouraged, and choose to use that as a growing opportunity, because I've learned that the doctors who take you seriously are going to want to push you because they realize that you can take that criticism and they realize that you can grow. If they didn't believe in you, they wouldn't push you. And so I now view that constructive criticism as a compliment, because it shows that, you know, they trust me that I can take it and that I can grow, and that I will apply that information. And I just want to be the very best doctor I can be, so I'm not discouraged, you know. So
I love that. Like looking at it as like they see potential in me and they're telling me this so that I can reach that potential. You're like, oh,
yeah.
Okay. Yeah. That's awesome.
So I noticed that a lot more. I never saw that as a pre-med, because I think a lot of people are hesitant to give you really good constructive criticism. Like, oh, well, we don't know if she's actually going to go to med school or not. But once you're in the medical school realm, and once you express interest, at least for me, once I expressed interest in surgery, they're like, okay, well, you need to shape up in X, Y, and Z.
You're like, oh, okay.
And it can be a little intimidating at first, but, you know, just be okay with it. It's all right. You can grow into the position. You don't have to be perfect right then and there. Like that's never the expectation. The expectation is, though, that you are teachable and that you're humble and that you're confident.
That's awesome. All right. Okay. Thank you so much. Emily, for taking the time to tell us all these things, and good luck as you start your third year. You're going to be amazing. So it'll be
Oh,
awesome.
thank you.
So, all right.
So good to see you again.
I know. Good to see you too.